All right. Hello, everyone. I would like to reach out to the African community, especially in Maryland. Number one, I would like to, first of all, to applaud all of you who are working with the COVID-19 patients and all those who are working at the front line, like myself, and the risks that are involved in trying to take care of the sick, especially our brothers and sisters, our African brothers and sisters, and African Americans, and everyone else. So I wanted to applaud you for that, and I do want to emphasize on the fact that please do take all these protective measures very seriously. It's quite important. All right, the second thing that I want to say is this, I want to address is this. It just came to my knowledge that we lost an African brother not too long ago. And this is, I think, the third or fourth death that I've heard that's coming from Maryland. Now, a few of them I know for a fact, some of them were directly associated with COVID-19 and others are not. But I do also understand that the African community are doing something and it's gone viral. And I just want to educate you a little bit. As a physician, I understand that it's important that you do whatever it takes to protect yourselves and your children and your households. However, I do not want my brothers and sisters to make themselves more vulnerable to this COVID 19. Now, I know there's a bunch of concoctions going out there, people mixing all the garlic and ginger and everything you can think of, and they're drinking these things. Now, this is a traditional antibiotics. If most of you know this, that is what it is, which is very synonymous to the pharmacological antibiotics. Now, the thing is, you don't just take antibiotics even when you're not sick. We prescribe this to patients when there's an infection, when they're sick. And after they're done with their course of antibiotics, they are taken off. And if they need to go into another course of antibiotics, there's a reason why we suggest that you take the second course of antibiotics with with the yogurt called probiotics. This is to help you to regenerate your good bacteria. Now, there are two kinds of bacteria in every body. There's the good bacteria and the bad bacteria. So, what the good bacteria does is it helps you to fight infections. It helps you to fight the bad bacteria. What antibiotic does is it kills all all kinds of bacteria, both the good bacteria and the bad bacteria. So that's the same thing that these concussions do as well. They kill all bacteria, even the good ones that are supposed to help you to fight off infections. So you can see that if you are taking these concussions, which are very acidic, and you're taking it every day, once, two, three times a day, you are ridding yourself from the good bacteria, not just the bad bacteria, from the good bacteria, and you're making your immunity very vulnerable. So you don't even have the good bacteria to fight the bad bacteria when they do come. Now let's talk about how this is related to COVID-19. If you have the infection, it's like an infection like anything else. So your body has to fight it off. But if you have removed both the good bacteria and the bad bacteria in the process of drinking this concoction that I make with garlic and ginger and I don't know what else is added in these mixtures, but you're making yourself very vulnerable. You are making yourself immunocompromised. And so you don't want to do that because when you are really exposed to COVID-19 or any other bacteria, you don't have a fighting chance. So instead of trying to help yourselves, you're doing more harm than good. Okay, now I'm not saying that do not do the concussions, but if you can do it once or twice a week on days that you are indoors, and then you try to get probiotics, what you'll be doing is this: you just be flushing out the bad bacteria, but you'll be living and making your immune system robust with the probiotics and just taking these concoctions just 1 or 2 a week. So please, agent, I felt very compelled to make this recording because it saddens me to hear that in the process of trying to protect ourselves and doing everything possible we can to protect ourselves from this COVID-19, a lot of my African fellows out there are doing more harm than good. And that is making you more vulnerable to this bacteria. And this is very detrimental. It's making you very vulnerable to this virus. And this behavior is very detrimental. So please, I beg of you, take your concoctions maybe 1 or 2 a week. But please do take it with probiotics so that you're making your immunity robust. Take vitamin C. Eat right. Eat vegetables and fish. Exercise as much as you can. Take zinc tablet. Take vitamin E. No, no, vitamin C. But please do not take this concussion. Do not drink them like water. Do not drink them like juice. It is an antibiotic whether we like it or not. And it is going to clean your immune system and making you extremely vulnerable to any kind of infection, be it a virus or bacterial infection. It's making you very vulnerable and you can die from the smallest thing as the common flu. That's how vulnerable you are making your immunity. Now, another thing I want to make very clear. Do not give this to children, especially very young children. Now, their immunity is still developing. And the last thing you want to do is to suppress that development. Please do not force it down the children's throat. Do not, you the adult, 1 or 2 a week. But please, if you want to give the children, maybe once a week. But please do not give them as though it's juice, because you are doing more harm than good. I just felt very compelled to make this little short video because I needed to educate my brothers and sisters out there who do not know that they are killing themselves instead of trying to help themselves. So someone has to reach out to you. Someone has to tell you the truth. And I'm here to tell the truth, not only as an African, not only as someone who cares about her family and her people, but also as a physician. It's important that you know this. Okay, if you have any more questions, I will hear of it, and I will make more videos to support you as we move forward. But I just needed to make this real brief video, recording rather, and to send it out and for you to listen to it. I hope you take it very seriously, and please do wear your masks as well. As much as it's a pain wearing it, please do wear it. Wear it when you're in the midst of people. Wear it when you're outside. But please, you take it off when you're home, because when you have the mask on and you're breathing naturally, the body wants to get rid of CO2, that is carbon dioxide, and then take in oxygen. But when you're wearing this mask and you're covering your nose and your mouth and you're breathing out this CO2, there's no oxygen that is going in. Instead, you're inhaling the CO2 back, which is going back into your system, into your blood, and making your blood more acidic. Which is why when you wear the masks for a couple hours, you begin to feel light headachehness, because the brain is not getting the oxygen that it needs. Instead, it's getting the CO2. Now, we cannot help it when we're in the hospital. And those of you who work in hospitals and nursing homes, you can't help it. However, when you have an opportunity to take it out, do take it out and take in some oxygen. Do not collapse from leaving your masks on when you can take it off and have a break. Okay? So please, I understand that it's things are contradicting themselves here, but I just wanted to educate you a little bit, and I really do hope you take it seriously and you remain safe, and God bless you all. Bye bye.